Once again, we're on the road here at Champion Physical Therapy in Kingsport. I'm joined by Dr. Charles Peters once again and Dr. K.T. Moyer and our patient for today, Austin Dalton. Is it Dalton or Dayton?
Dayton.
Dayton, sorry. Austin Dayton. Austin has had some issues with his elbow, and Dr. Peters, tell us what you're going to be doing for Austin today as far as the dry needling is concerned.
So today we're going to be talking a little bit about tennis elbow. Very common right now this time of year with people playing sports and recreational activities. So very common for people to talk about having pain on the outside part of their arm.
Right.
With gripping, turning, twisting, people that even maybe at a desk job. Those are some key areas where people have some type of dysfunction and impairment. So what we're going to look to do today is we're going to look to treat that at where the common site of pain is.
So show us how you're going to get started with this dry needling procedure on Austin's arm.
All right, what we'll do here, normally I would take the needles themselves. I'll kind of demonstrate or discuss with the patient what we're going to do. So the target area we're going to be working with is right along the painful area of the elbow here. So we're going to go there into the forearm. So as you'll see here,
right.
Again, normally now what you may feel is a little pinprick. Sometimes you won't feel much of anything at all.
It's not painful at all. Mm-hmm. I mean, very minimal pain with this procedure.
So sometimes you'll have really worse than having your finger pricked when you get your blood tested.
Well, while he's inserting these needles, let's talk about Champion Physical Therapy here in Kingsport. You're over this amazing facility here. Talk to us about some of the services you offer here.
Well, we see everything from geriatrics to pediatric population. We'll see gait and balance issues, vestibular problems like vertigo, back pain, neck pain, shoulder pain, everything in between. So we do pretty much all.
And dry needling, something that y'all been doing for a while now.
Yeah. We've started dry needling for
a little close to a year now.
A year now.
So you've got 2 of those needles in now. Mm-hmm. How long do you leave those in, and what are the effects that Austin's going to be feeling here?
So you can remove them immediately, or you can leave them on for a little bit longer time period, for a minute or 2 if you need. Now you will have typically a localized twitch response, is what we're looking for, very common. Or generally you won't feel anything at all, which is a good thing. So a lot of times you don't want that pain or discomfort. So what I'll do here, I'm going to go ahead and take these out.
Okay.
Now I will tell people if they don't have that initial kind of a sting or anything,
right,
they'll have maybe a dull ache. So your arm may feel a little heavy. So if anybody's ever had an injection later that day, your arm just may feel a little heavy. The area you'll notice some tenseness in the muscle, but we're looking for a decrease in pain. So it can be immediate,
right,
or later that day or the following day.
And you're going to have more than one treatment, more than likely.
Yes. So typically, to get a prolonged response, you can look for an immediate change in the soft tissue, but you're looking maybe 4 to 5 sessions is where you'll start to see a remodeling process last.
And Austin, I'm going to ask you real quick, how does it feel now that they've been in there? Describe that sensation when they were going in and when they came out.
Actually, going in and coming out, I didn't really feel anything at all, like you said. And right now, I kind of have just the light ache. Kind of feel the heaviness almost, but really nothing at all.
And that's what you want. That's the sign that what you did is working, correct?
Yes, sir. So immediate response is nice. Now, that's not always the case,
right? But
you will have people talk about, I can tell a difference right away. To get that lasting effect, we will supplement the area with some additional manual therapy or some therapeutic exercises to strengthen the tendon that's affected.
And KT, how proud does it make you feel that you're able to help folks that come in here with so much chronic pain? And this is just one area that you can help them with, but how does it make you feel being able to help folks with their chronic pain?
It's amazing to see, somebody going who's hurting, they're not functioning like they want to, and to see them go back to everything they were doing and just the light in their eyes that I don't have that pain anymore. It's so rewarding.
It has to be rewarding.
It is.
And doctor, let's talk about, once you've done the treatments on this, you also supplement that with some other, like you said, some other therapies, some other exercises as well.
Right, so we also will use manual therapy techniques, so we do a lot of hands-on work as well. You'll see everything ranging from kinesiotaping, which is also another type of therapy that we apply. And then we'll also do some good tendon conditioning, so we'll choose the right type of stretches and exercises that'll help the affected area.
And we're here at the Kingsport location of Champion Physical Therapy, but you all have everywhere from Knoxville to the Tri-Cities and everywhere in between, so many offices that folks can visit.
Yes, so currently in the Tri-Cities, we have offices in Bristol, Johnson City, Elizabethton, and our latest office here in Kingsport with Katie.
And Austin, you think you're going to be ready to, you're a baseball player. You think you could get back out there today?
Oh, I definitely think so.
And I know you picked up tennis. That's going to take care of that tennis elbow.
Oh, absolutely.
All right. And KT, you got this great facility here. You encourage folks to come by and just drop by and check it out, right?
Yeah, oh yeah, stop by. I'm always available to talk with you about your pain or anything that I can help you with.
All right. And Dr. Peters, same thing with the one in Elizabethton. You want folks just to come by, check out Champion, see what you have to offer.
Absolutely. Our biggest goal is to let people know what we can do and how many areas that are affecting their lives that we can help improve that quality of life, really. That's our biggest goal.
All right. Dr. Peters.
Thank you.
KT. My good friend Austin, thank you.
No problem.
Hope that elbow is feeling much better.
Thank
The
you.
dry needling, folks, it is working wonders. Right now, you can actually, I love watching those needles go in because no pain, but helping so much with this arm that is causing him so much problem. It is dry needling. It's available here at Champion Physical Therapy. Locations everywhere from Knoxville all throughout the Tri-Cities. They want you to stop by and check them out today.